Hello everyone, my name is Dr. Lavanya Govindaraj and today I am going to be discussing about the microvascular complications of diabetes. High blood sugar levels over a long period of time can cause harm to various parts of your body. But this is not the whole picture. Genetics and lifestyle do play a part too. The parts of the body affected by complications of diabetes are the heart, the blood vessels, the eyes, nerves, kidneys, and the gums. Most complications of diabetes are a result of the damage to the blood vessels. When smaller blood vessels are damaged, they are called microvascular complications, and when large blood vessels are damaged, they are called macrovascular complications. Today, in this video, I will be talking about microvascular complications from a patient's perspective. Okay, so let's go into the microvascular complications in detail. So the three microvascular complications of diabetes are retinopathy, which means the damage is caused to your eyes. The second one is neuropathy, where your nerves are affected. And the third one is called as nephropathy, in which the kidneys are affected. So let's look into each of these in detail. So first one is retinopathy. What is retina? The retina is the light sensitive layer at the back of your eye. High blood sugar levels over a period of time can cause blockage or damage to the small blood vessels in the retina. So what happens when these blood vessels are damaged or blocked? New blood vessels start to grow. But these new blood vessels are fragile and they easily bleed. Although you will not notice any symptoms during the early stages, these changes progress, eventually causing loss of vision and even blindness. So, what can you do as a patient? So, you should be doing your annual eye screening. This is called as the diabetic eye screening. This is different from the normal annual eye test you do to check your eyesight. In diabetic eye screening, the retinal damage is found even before it causes problems to your sight. So it's very important to attend your annual diabetic eye screening. Okay, so as a patient, you will be interested in knowing how can you prevent this retinopathy or the eye damage. The most important thing to do is to keep your blood sugar levels within the target range, which is between 4 to 7 millimoles. But again, some patients do have individualized targets. So it's very important to discuss with your GP or the physician to know your individual target. The second thing, as I mentioned before, is to attend your annual diabetic eye screening, where your retina will be examined to look for any signs of retinal damage. So, if problems are detected early, it's very important to remember that these problems can be treatable and sometimes reversible. Okay, let's move on to the next microvascular complication, which is neuropathy. Neuropathy. Neuropathy is a type of nerve damage that occurs in patients who have had diabetes for many years, for a long duration. Nerve damage can occur in different parts of your body, like your feet, your digestive system, your urinary system, your heart, eyes, etc. In early stages, the symptoms will be like numbness, pain, or tingling in your lower legs and feet. But if high blood sugar levels persist for longer duration, then more serious problems can occur, leading to ulcers and infections. So it's very important as a patient, you need to report to your GP or your physician if you notice any symptoms like numbness, pain, tingling, etc. Because if problems are detected early, they are treatable and further damage can be prevented. Okay, let's look into how we can prevent this neuropathy. So, as a patient, your most important goal is to again keep your blood sugar levels within the target range. I think you will remember me mentioning it in the previous retinopathy discussion. So the target range ideally will be 4 to 7 millimoles, but again, as I mentioned earlier, these targets are individualized. The second thing is to follow a healthy lifestyle, eat a balanced diet, quit smoking, and follow a regular exercise routine. And another most important thing to do is to make sure that your feet sensation is checked by a specialist at least once a year during your annual review. Again, as I mentioned before, if problems are detected early, they are treatable and often reversible, and it can be life changing. Okay, let's move on to the next microvascular complication, which is nephropathy. The kidneys eliminate waste products from the body by filtering the blood. High blood sugar levels over a long period of time can cause damage to the small blood vessels. So what happens is the kidneys doesn't function as well as it should. So what happens as a result of this is the waste products get accumulated in the blood, and this can cause damage to various parts of your body. So, in the initial stages of kidney disease, you will not notice any symptoms or signs. However, small quantities of a protein called albumin will be leaking out of the kidneys into the urine. And this can be detected by a simple urine test. So, during your annual review, what your physician or the GP will do is they will do a simple urine test to see if there is any albumin in your urine. The most important thing to remember is that if there is any kidney damage or if any kidney damage is suspected or detected in the urine test, things can be done to protect your kidneys so that we can prevent life-threatening kidney damage or renal failure later in your life. So let's move on to see how you can prevent nephropathy. Again, the same thing. The most important thing is to keep your blood sugar levels within your target range. The second thing is to make sure you keep up with your annual or your routine diabetic appointments and make sure that your urine is checked at least once a year to check for albumin. This is usually done for adults and children over 12 years of age. Again, remember, if problems are detected early, they are treatable and often reversible. Okay, now looking at all these microvascular complications, you will be thinking like, does everyone with diabetes develop these complications? No, not at all. Not everyone with diabetes develop complications. There is very good evidence that good control of blood sugar, blood pressure, maintaining a normal cholesterol level, following a healthy lifestyle, and not smoking can prevent complications in most patients. So remember this. Okay, now we've come to the end of the video. So I would like to reiterate some take home message or some learning points for you. The first thing to remember is all of the above risks or the complications I discussed above can be dramatically reduced if you keep your blood glucose levels within the target range. Again, the target range ideally will be 4 to 7 millimoles. And again, I would like to repeat, these values can be individualized based on your comorbidities. The second thing to remember is it's never late to do something. It's not late at all to do anything good. Even small reductions in hemoglobin A1C can make a big difference. The third thing to remember is it's not just your blood glucose. Good control of your blood pressure, a healthy balanced diet, regular exercises, and not smoking are all important too. Thank you so much for listening. Thank you.